Like I did last time, I'm going to send you guys the link to that Google Doc so you can use all the resources in there as well. But I'm gonna share my screen here because so you guys have something else to look at besides my face. I'm just kidding. I don't snort. I don't know how to do that. All right, let me figure out how to get you guys all in here. All speakers. Can I move you like up here? There we go. Okay. Can you all see my screen? Melissa, Sam, Claire, Shelby, I can see you all up in my front view, so I want to make sure I can, okay. Anybody else comes in? I don't know what to do then. Hold on, I'll give it a couple more minutes or seconds because I want to be able to let people in. There we go. Stop share, just for a second. Okay, all right, I'm just gonna get going. All right, so talking about birth control. So first I want to just obviously provide this because number one, when I got on birth control, I wasn't informed of all the options out there. And I kind of made a post about this maybe a month ago, is I was just painted a pretty picture of, oh, it's going to help with like better sex. You're obviously not going to get pregnant, and helps with acne, your periods won't be as bad anymore, blah, 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 blah. So because of what I went through, I kind of want to share you guys my experience. And on top of that is like what I've learned afterwards through the course of this time period. So first, I just want to go over the hormonal birth control options. And then there is non-hormonal too. So these options here have hormones in them, and I kind of detailed which ones they have, and this one just specifically the frequency. So birth control pills, those are those oral contraceptives. They contain estrogen and progesterone, and there's two kinds. Birth control pills, one is a combination, and the other one, combination would be of these two, estrogen and progestin, and then the progestin only. And this one also called the mini pill. I've never heard of that, but so be it. Hormonal IUD, this releases progestin. There's shots. You would get those every 3 months, and those are progestin patches. I don't know if anybody has had patches or seen anybody with those. Those are estrogen and progestin. Implants, rings, all those options there contain hormones. Non-hormonal would be the copper IUD. It releases, well, it's made of copper. It doesn't release copper. I need to change that. The copper acts as a spermicide, but in this is also 99% effective with preventing pregnancy. Compared to the hormonal IUD, it is larger. So when I particularly went to go and get an IUD, the gyno was like, well, you haven't had kids yet, so this is going to be pretty hard for you to get the copper one in. It's going to make your periods worse. So if they were pretty heavy before, he told me they would be even heavier. So I went with the hormonal one, which looking back, I wish I didn't have done that, but oh well, I was painted a picture that the copper would be really bad. But they can also last, the good thing about IUDs is they can last anywhere from 10 to 12 years, which is really nice. And especially a non-hormonal one, you could get the copper removed, and then like if you wanted to have kids, you could get that removed, and pretty right away, you should be able to be fertile, and you won't have any negative effects after removing it that you have to have your body recomp from, because there are no hormones in it. But the downside of this one is that there are some reports of people getting copper toxicity, which looks the same way as maybe somebody who has been on birth control for maybe 10 to 15 years, and they're trying to recomp their body, get their hormones right after that. So both situations can lead to kind of a long-term, like helping your body, getting it back to normal again. Condoms, female condom, I never even knew about this, but anyways, found that it's inserted to the vagina prior to sex. Male condom, we know this one. I made a little note here. If you put it on the wrong way, swap that one out, because pre-cum still contains some sperm, so do it the right way the first time. Fertility awareness tracker. This one is very interesting to me. I have been trying to utilize this in a way. but it's completely natural, hormone-free alternative if you're looking to get away from the conventional birth control. You track your menstrual cycle daily, and by doing this, you can figure out which days in the month you're most fertile, and you can avoid sex during those days. Now, used absolutely correctly, it is fairly good at preventing pregnancy, but you have to be committed to tracking this religiously and then eliminating those days that you could potentially be fertile. You just got to say no, and you can't have sex. So involves some being very hard on yourself there, and being very aware of your body and where it's at in its hormonal loop of that 28-day cycle. So if you're wondering, which days of the month are you most fertile, it is that like a week and a half to 2 weeks after your period, where you're in that ovulation phase. And I've been really in tune with my body and trying to really understand what phases I'm in, because I look at my app and I'm like, oh, it says I'm ovulating today. So very interesting though, if you're ovulating, you have different symptoms that you would have versus when you're in your period. But when you're ovulating, you're probably going to have the most goop in your underwear. So in case you want to know, like, what, if you're ever ovulating, you're like, oh, it's been a little bit after my period. Big goop in your underwear pretty much tells you that you're ovulating. All right. Next would be the withdrawal, which is basically the pull-out method. Partner removes prior to ejaculating. I like to note it's not doctor recommended. Sterilization, and there's something called e-coil. It is a coil that's placed in your fallopian tubes, and the way that it prevents sperm getting into your egg is by forming scar tissue, which traps the sperm. And if you just think of that for what it is, you're like, why the hell would I put something in my body that's just going to create scar tissue? Because scar tissue is really, really tough on our body. And that's something that can impede a lot of different things. So I wrote a note here. It said it's not appropriate for any women. And by the way, the information I got this from are from doctors, and it's on their website. So, and their articles that they wrote. So they wrote these things too. It's like, I would never recommend that for any women. So I don't know if this is still a thing, but it is an option, I guess, non-hormonal. Diaphragm cup, you have to manually apply the spermicide if you're using diaphragm cup. And the difference between that and the sponge is it releases spermicide, so you don't have to manually use it. And then you get your tubes tied and vasectomy. Both of these are surgical procedures, and I would like to note that this one is minor. Most guys freak out about it, but it is pretty minor. And most women will get this done when they decided that they don't want to have any more children, so they'll get that done in the same situation when they have like a birth. So kind of knock two birds out with one stone in a way. So the purpose of birth control that really came out is obviously to prevent pregnancy. And the pill works essentially by shutting down. Zoom has me on etiquette. Hold on, I gotta let people in. Don't mind me. Okay. So what was I at? Oh yeah, the pill works by shutting down brain signaling to the ovaries, which prevents ovulation. So this is super, super huge. If you want to think about in long-term use of birth control options, is you have ultimately stopped your brain from talking to your ovaries. Let me repeat that again. You have shut off the connection from your brain to your reproductive system. That's huge. And the copper IUD works by blocking spermicide. I already mentioned that. But there has been other incidents where birth control is prescribed to somebody, and it could be for any of the following issues: hormonal acne, and this is very severe. Like somebody that has very severe acne would definitely get prescribed birth control. Anybody that's coming in with painful periods, headaches, endometriosis, and PCOS. So I kind of created a little list of things to ask your provider. And, maybe you're on birth control now, maybe you're thinking about it later and you have an appointment coming up. So I kind of jotted down some ideas of things that you could ask your provider, and don't be afraid to question them, because you have a right to know their thought process and know if your health is in their best interest, and not just health for this time being, but for longevity for your life. So I would just go in by saying, what option is best for me? And if they give you an answer, I would be like, okay, why? And be fully aware of your previous medical history too. If you have family history of certain conditions or your own, that is very important too. So it's individualized. It's not just, you know, when you say what option is best for me, this should be the big bulk of it, because this is who you are. How can birth control help me with fertility down the road? If you do want to have children later, you know, I would like you guys to get their educated response on fertility, if it's going to impact your fertility or not. And definitely this is a huge one. Blood labs. You should get work done if you're considering this, and they should do it for you. That should be something they test before they prescribe you any of this, because it is so crucial to know where you're currently at in all these different levels, because birth control affects some of these things, and it would be good to know if you're in a good spot health-wise to implement this, that it's not going to impact you too much. So if they are opposed to ordering those labs, I wrote, if not, why are you opposed to ordering them? Just getting their thoughts. I don't know. I like to challenge people. So definitely I would be challenging if they say no, be like, why not? Another question you can ask is, have you read my blood labs? You know, if you have had blood work done recently, ask them like, hey, have you read my blood labs recently? I got it done maybe a month ago. I was just wondering if anything like spoke out to you about where I'm currently at with my health. Would this still be something that is okay for me? And if you don't have them yet, you can request to have the following tested. And I'm going to provide, so this link right here is, I have got my blood tested. I don't have insurance, but I also, when I did have it, I used this blood lab specifically through Life Extension, because it is a complete blood panel to get tested for like every functioning part of you. And it's called the weight loss comprehensive panel, but it's really just a whole, like, look at all this stuff it tests. Is it, you know, most doctors, the reason I'm kind of skipping ahead, but the reason that I like gave this to you guys is because this is going to be more conclusive than you will get with any blood lab ordered by your doctor, because you could be like, hey, I want to get my thyroid tested, and they might just test your T3 and maybe TSH. Like, there is so much more to look at in the whole scheme of things of how your body is functioning, that they don't do that. And I can't tell you why. I'm not sure why, but I would just order these yourself. I always Google a discount code for this. It is expensive. It is, I think, $200 and some dollars, like over $200 for it. But I get it. You basically pay for it, and then they send you the like lab work that you're going to take to a LabCorp. So I actually just did it this week. I printed off their lab testing form, and I walked into LabCorp. They took out the blood, because it already tells them how many blood panels to take out. And then LabCorp sends it back to Life Extension, and Life Extension will go through and analyze the data and then give it back to you. And if you know somebody that knows how to read blood panels, I usually send it to one of my doctor friends like that, and they read it for me and kind of translate to what all this means. But I think it's the best for looking at all these different things: T3, free T4, and T3, reverse T3, your thyroid panel of TSH, T4, DHEA, fasting insulin, your AM and PM cortisol. And this is important because this tells you, you know, we're going to have higher cortisol in the morning. I think I talked about that when we talked about stress last week or a couple of weeks ago. But it's good to see what your cortisol is like from the AM to PM. So if it's still spiked up here, there's an issue. Like, it should be dropped. So those are good things to look at too. FSH, these are your sex hormones here. And it's, if you're getting it tested, you need to do it on day 20 or day 19 to 22 of your 28-day menstrual cycle. I did mine on day 20, I think it was 22. So I did it right then. That's perfect. And then looks at your testosterone, your total and free, all that good stuff. So another question you could be asking is, hey, I've been experiencing blank, blank, blank. Do you think this is related to being on synthetic hormones? And get their stance on what they believe about hormones. If synthetic hormones are good for our bodies, you know, just what they say. Overall, you're just in this conversation to learn more. What options are available for me to prevent pregnancy? That's a big one. Make sure that they tell you what's all out there. And if they're leaving some out, you know, why are they leaving some things out? What are their non-hormonal options? Anything like that. There is this Daisy fertility planner thing that I have found. I haven't purchased it, because it's very expensive, but basically it is a way to test your fertility, like if you're going to be fertile one day, based off of your temperature. So I think it's like temperature and heart rate related or something like that. I don't know, but it's very comprehensive. So if you guys are interested in something like that, you can always click this or click this, copy and paste it, look it up. And then what research have you seen from women in your clinic being on birth control for over 5 or maybe even 10 years? So get some data of like, hey, you know, you've obviously seen a lot of women like me. What has been their health like from, you know, 5 to 10 years of being on this? I'm curious. I want to know what the future looks like for me. So let's break it down to how can birth control, specifically the hormonal birth control, and this is where I'm getting specific here, is mostly that synthetic hormones. How can this affect you? Number one is nutrition deficiencies, and this is magnesium, folate, B vitamins, B6 and B12 specifically. And I will note here that some forms of birth control pills are adding in vitamins because they found that they do deplete these in our bodies. So they're like, well, let's just make it more appealing and give them vitamins in it. So whatever. That doesn't necessarily mean your body's uptaking it either. Vitamin C, zinc, and this leads to leaky gut. I've talked about that before too. And yeast overgrowth in the vagina, gut, and mouth. Overgrowth in gut here could be SIBO. We know what that is. I talked about it when we talked about stress in our gut, that overgrowth in your small intestine. Increased risk for cancer. Anytime you're messing with synthetic hormones or hormones at all, you have an increased risk for cancer, particularly breast, pelvic, things like that. Changes structure and chemical of your brain. That's huge. And remember I talked about how it shuts off that communication from your brain to your reproductive system. Huge, huge, huge. Low sex drive, vaginal dryness, painful sex. This has been shown to lower your sex drive by up to 42%. I just wrote a comment here, use lube. Speaking from my experience in life, when I was on birth control, I had zero sex drive. And you know what I believed is I thought that was just me. That was just how I was. Once I got off birth control, I realized, oh my God, for so many years, I just thought I wasn't a very sexual person. And that was so wrong. And I had no idea that had anything to do with birth control at all. And then another note here about the lube is some women can feel like, well, no, like I'm good. I create enough down there. I'm good. I don't need that. Just don't drop your ego and just use it. It can definitely help with the dryness. You might not think you're dry, but you could be dry due to it too. So it interrupts your adrenal health, and this is related to that chronic stress. So think about, this, for example, you have synthetic hormones in your body. That birth control itself is a stress to your body. So now you're having it from how long? Maybe you're 5 years in birth control, maybe you're 10 years in it. That is continuous chronic stress. Impacts your thyroid function, and this is with any type of synthetic estrogen will impact your thyroid. Loss of energy, this is related to your thyroid and adrenal. Hair loss, this is definitely linked to the thyroid as well. Depression and anxiety, this one's big. I know a lot of women that have came off birth control definitely were experiencing depression and anxiety while they were on it. They had no idea it was related, but then they got prescribed anxiety medications and things like that. Risk of stroke, heart attack, blood clots. And, I have to ask you to question these things is, if that risk is worth it, if you already have this running in your family. And if you already have this running in your family, who those individuals have never taken birth control, you already have that risk to begin with without birth control. And now you're putting the birth control on top of that, creating even higher risk. Impacts your weight management. It blocks estrogen, which basically blocks, it makes you gain fat because it blocks your estrogen. So I kind of detailed in here, how can it promote weight gain? And these are other reasons too, by fluid retention. Again, that's stress as well. Low testosterone, loss of muscle mass, estrogen dominance, progesterone replacing progesterone, low thyroid hormone, etc. So some things to implement to benefit if you're on birth control or coming off of it. And I kind of just created a whole list here. Obviously, number one, balance your hormones by eating healthy for your body, eating the good things, getting rid of those processed foods that are toxic to our body, even stressful in our body. And just go ahead and try to limit those that you have in your diet and really replace by eating good for your body. Number one, I couldn't recommend this more, prenatals. That was huge for me. Omegas 3 and 6, vitamin D3 to help with mood. And this is energy as well. So a lot of people are deficient in vitamin D3, but as soon as you start to take vitamin D3, you're going to notice a world of difference. You're going to have so much more energy. And it's crazy with just a vitamin like this, you can do that. But this is one of my little secrets here is the vitamin D3 and omegas and prenatals for anybody that comes to me that's talking about energy, mood. When I make posts about like, oh, I help women get energy back. Like, it's because I know this little secret right here of like, I can have them start to take vitamin D3 or change their eating to implement these things, and they're going to instantly feel so much better. So that's just a little nugget of like, how I can know I can help people very quickly based off of energy and mood is just these 3 things right here. Ask them to implement it and I can change their life. Promise. DIM, 100 milligrams, 1 to 2 times daily. This just depends on the person. But if you know that you are estrogen dominant, and there are tests and things that you can obviously find out if you are. But if you take this, it can also shed some of that body fat on those high estrogen areas like our thighs, glutes, waist a little bit, where women tend to carry our fat is because those are high estrogen areas, and DIM can help that as well. In a way, like it can help it by blocking some of that overproduction of estrogen you might have. And I just put in a little screenshot here of some supplements to implement and some of the recommended values to take. So you can just go over that. Basically turmeric, we know that helps with anti-inflammatory. Omega-3, as I talked about, B vitamin complex, blah, 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 blah. Magnesium, vitamin D3. What foods are in or out? Basically, this is what I talked about. We're eating better foods for our body if we're going through this phase. If we have birth control or we're getting off of it, eat your healthy fats. Don't be afraid of fats, but definitely eliminate those inflammatory fats. And these are all good suggestions right here. Fruits and vegetables, high quality protein, water, blah, 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 blah. And I think she mentions, she said to limit alcohol and caffeine. And I think that's if you're over consuming caffeine, like having 1 to 2 cups of coffee a day, that should be golden. That's just at least my 2 cents. I love coffee. So I'm going to root for that in all cases that I can. Bone broth versus dairy, opt out dairy. If you're dealing with these things, you hear me talk about those, big 3 that I remove. Here's the gluten, here's the dairy, and here's the processed foods basically right there. So that's all she's talking about too. Fermented foods, adding in sauerkraut, things like that. So I dropped in here just some resources for you guys to read. And when I say read, it's really just for this one here. It is a PDF that I'm sharing with you guys. So I purchased her book, Beyond the Pill. It's a PDF, and this is just her little like guide that came along with the book. So I downloaded the book through Amazon audio or whatever. And this was a attachment she had in there. So a lot of this stuff I pulled from is in here too, but I'm giving this to you guys to share. If this link doesn't work, let me know. But this was really beneficial. And then Sam Miller Science, I don't know if you guys know of him. He's a big health and fitness guru that's kind of starting out. He talks a lot more on the diet side, nutrition aspect. Very, very smart person. So here's his podcast. And this was just a specific episode that can relate to birth control that he talks about. And then this episode too was a good one I listened to, the role of birth control. And this one's for those, I'm not going to say this is for general population. It could help you if you're just, and when I say gen pop, I mean you're not an athlete that is training specifically for sport. So this episode is I think if I remember correctly, it was basically for, bodybuilders or competitors or anything like that. But also I do think a lot of that information is very valuable for anybody based off of the birth control and the way it impacts our body for workouts and stuff like that. So please dig into this and just get different perspectives on it, because this one was a really good one. That the actual fact I have here is pill bleeds are not the same as real period bleeds. I definitely got that statement from this podcast episode. So just go ahead and check these out. They're super awesome. This episode right here on the Model Health Show podcast, these are on Spotify too. This one I know for sure is, but this was an episode actually, with the model health guy. I forget what his name is, but he had Dr. Jolene Brighton on his podcast and they talked about birth control. the truth about hormonal birth control. So very valuable stuff right here that you guys can dive into. And they're podcasts, so you can generally plug them in as you're walking, driving, whatever. So just some last few facts I want to spew at you. You know, like I said right here from that episode, pill bleeds are not the same as real period bleeds. Birth control stays in your system for up to 27 months after getting off of it. And this is what's challenging when you're trying to get your normal period back after getting off birth control. My personal experience, it took me 5 months to get my period back, and I had to eat a lot more food, and I had to stop training. Not stop training, but I had to really take down my training. I implemented a lot more yoga, a lot of stretching, tried to not run as much and just did more walking. So I really had to come at it all different angles. And I will say I did buy a couple supplements to really help that. And the one that I bought was chasteberry extract or chasteberry extract. I don't know how you pronounce it, but that's a natural herb, but it is, you know, known to help kickstart some of those period, whatever hormones like estrogen or whatever. I don't remember which one it specifically triggers to kickstart your period, but I took that, and after 11 days after implementing that supplement, I had my period. So I kind of swear by that, and a couple other supplements that I used. Jumpstart was another one by New Ethics, and that was kind of related to the same thing. It just balanced your estrogen and progesterone. So, you know, it's a supplement that has natural herbs in it. So if it says it's balancing your hormones, it's basically, if you're over, it's going to balance it out by meeting in the middle. If you're under, it's going to bump that up to balance it out in the middle. So supplements are really good for these points in times when it's very important to get your period back. And that is what I had to do. So PCOS is the most common diagnosis for people getting on birth control. And the symptoms of this look like severe periods, hair in the wrong places, gaining weight. And the reason I dropped this in here is because I don't know if anybody knows, oh my gosh, I just drew a blank on what his name is. Dr. Serrano. You guys might not know who Dr. Serrano is. I don't think I can see your guys' faces anyways. There you guys are. Anyways, he is a practitioner here in Columbus, Ohio, and he works a lot with the bodybuilding, the power lifters, the extreme dieters, all those people. He works a lot with them and helping their hormones and getting them onto the stage and being ready. So we know that stuff is very extreme. So I went to his seminar at the Arnold, I think it was 2 years ago, and he talked a lot about this stuff. So I pulled this clip from that seminar I attended with him that I took notes on. And he talked about like PCOS right here. So I don't even really know what this part of it that I wrote down from that was. Almost always requires progesterone. Oh, so maybe with PCOS, it requires progesterone. For some reason, I don't know what this has to do with it. Not using cream allows to fall asleep. Normal breast protects against cancer. Cream or gel doesn't protect as much as oral. So those are notes that I jotted down. I'm not really sure what the heck I was talking about when I wrote that, but I was like, well, maybe I'll piece it together when I actually like sit down here and read this, but I'm still not really sure about what creams I'm talking about. So maybe I'm talking about progesterone creams. I don't know. I'm not sure, but moving on. Can birth control affect who you're attracted to? So I put this on here because I go to her, Dr. Jolene Brighton's website all the time. So a lot of the stuff I talked to you guys about, I pull from her. And this was an interesting article I came across on her website of if birth control can affect who you're attracted to. So I also, encourage you guys to follow her on IG. Like, just do it, please. She's awesome. So more on some of that weight gain that I talked about. I'm going to reset gym goals because I talked about it here. But the pill can lead to lower muscle mass and strength gains. So that sucks. And by extension, it's lower metabolism. So the fastest way to bump up metabolism, I've talked to you guys about it before, is building muscle, which is why I have you guys all doing strength training in some way. But birth control can definitely mess with that and those gym goals. So that's a good insight. And this is a kind of body composition change that doesn't just resolve when you stop taking birth control. Like I said earlier, it can stay in your system for up to 27 months. That's huge. So another point about that is your basal metabolic rate, or the amount of calories you burn just as being a part of a human being, is higher after you ovulate. So that's like me right now. Another reason why you ovulate is so valuable. So on the pill, however, you do not ovulate. So you will not experience those bonus bumps in metabolism. The worst. So that's my blurb on birth control. So does anybody have any, because I know we're all we can all relate to this in some sort of way. Does anybody have any like experience themselves, whether they're on it right now? Like, have you felt like you've hit any of these symptoms I've talked about, or is anybody off of birth control that's like, oh yeah, I was either better or worse after getting off of it? Does anybody have anything they want to share? You can just go ahead and unmute yourself if you do.
I can. This is Haley. So I was on the shot for a while, and it actually made me bleed a lot more. I actually became anemic when I was on it.
Oh my
and
God.
so I actually got off of it. And it was so that's like a horror story for the shot. If anybody is like thinking of getting that was my own personal. I was trying to like stop my periods, and it went like the opposite effect. So it was absolutely terrifying. But yeah.
So what prompted you to get the shot versus the other options?
I'm not great at taking like pills every day unless I have like a reminder or something. And so I would frequently forget. And for something as important as birth control, I wanted something that would just be kind of do it and forget about it. So like shots or like IUDs or patches. And this was years and years ago. So the only options around really at the time were, and I was really scared to do an IUD. I think I was like 20, 19. And so I went with the shot because I had friends who had successful stories with it. And mine was just straight out the bat, just awful. The needles were dull. It hurt so bad. You can tell when there's like a dull needle. Anyway, it was awful. And you have to get it like in your like upper butt cheek.
I was going to say, isn't it in your ass?
Yeah, it's awful.
So
it was, but yeah, it was so painful. And then, like I said, I actually was scheduled to like donate blood at the college that I was going to. And I ended up not being able to because I had become anemic because I bled for like I was on it for almost a year, and out of the entire year, I think I had not even concurrently, but maybe a solid like 2 months where I wasn't bleeding. It was just, I was constantly, yeah, it was awful. It was the worst experience ever.
You had zero zilch of energy. Oh my goodness. I can't even imagine.
It was the worst. I immediately, like, I've never even reconsidered getting back on it, even after people are like, oh, like if they've improved things. I'm like, absolutely not. Like, horror story. But I've heard really great things about like the IUDs and everything. And if I was able to consistently like take pills, I'm just the worst at it. I've even got a reminder on my phone to take daily vitamins, for goodness sake, because it's just so bad. But that's why I went with the shot, and horror story for sure.
That's why I went to the IUD too, is I would miss my pills on the birth control pills, and I'm like, I'd have to go buy a new pack and like waste more money because I messed it up. And I think I messed it up too many times that it was just like, I'm not even doing this right. Like, it's not even, I'm probably hurting my body more because I'm taking pills when I was supposed to be on a 28-day cycle. I don't know. It was all over the place. And then I got the hormonal IUD. And I think if I were to go back and get birth control, I think I would do the copper. I'm just not 100% convinced or ready to do that yet, because I feel like I'm still trying to get my body hormonally up to par. So I feel like I might be doing myself a disadvantage at this point if I were to get it. But that would be the one that I would get because it is non-hormonal, but I do have a fear of that toxicity. And I feel like that would just hinder
I actually have a story about that. I actually had the copper IUD for 2.5 years. And I actually had a very similar experience to what Haley had. I bled so much that I became anemic, and it wasn't like length. Yeah, my period became longer, like 10 days, but it was just how heavy it was. I would bleed through like a Super Plus tampon in an hour, and like not just bleed through, like gush all over myself.
Like that's me now.
It was terrible. And I felt I had no energy, and like the cramps were different. Like they didn't feel like normal cramps. They were like, I don't know. I don't know how to explain it, but like more like stabby. I don't know. But
because it's probably your uterus is contracting like a
it's like
copper.
It was like trying to get rid of it.
Yeah.
I think is what
exactly.
It was. So I endured it for about 2.5 years until we started trying for our second baby, but I wouldn't do it again. Although, it was nice having non-hormonal options.
Yeah.
Because I'm allergic to like 80% of the birth control pills out there. So, so that was nice, but it just was not a great experience. Luckily, my husband took one for the team and got snipped. So,
I was going to ask you is after you got the IUD removed, like, did you start trying right away?
We did.
And then how long before like it actually like worked?
Let's see. We started trying in May of last year and we got pregnant in August. So I think it was like 4 cycles.
Awesome. That's cool.
And we were also 34. So, you know, it's a little harder when you're older anyway, but it didn't take too long.
That's awesome. Very awesome. Anyone else? I got 2 minutes left. Y'all can see my thing. Click it. No, maybe you can't. Yeah, I got 2 minutes left on here. I
can speak a little bit.
Yeah,
I had the hormonal IUD, the Mirena, and I only had it in for a month. And I would say my first cycle while on it, I was like, woke up and I was throwing up. I was dizzy. I was so nauseous. So then I ended up going to urgent care and they're like, it's probably your birth control. And I had no idea birth control could do all that. So I immediately scheduled to get it out. And of course the doctors were like, why do you want it out?
Right.
Keep trying. And so I was like, no, I want it out of my body. And I got it removed and it's probably been like 6 months and I'm still dealing with like anxiety and other things that I never had prior. So I feel like there's still an imbalance in my hormones from it. But I'm like, nope. They even said about the non-hormonal, the copper one, and I'm like, nope, I'm never taking birth control ever again.
Yeah, it's tough, but yeah, I haven't really decided yet, but that's crazy. If this shuts off, like, because I have less than a minute, I just want to get everybody on here. Let me see how I did this. Oh yeah, okay. All right, for those that I can see on my screen, I'm gonna do a quick picture. Y'all smile and like just whatever. All right, 1, 2, 3. Awesome. Thank you guys for joining in. I forget what I don't know what I'm talking about until like later on the week for next week, but thank you so much. Hope you guys loved it. I'll drop the document in WhatsApp so you guys can all see it, click the links and use it. Okay.
Bye. Thank you.
Have a good night. Bye guys.
Bye.
Bye.